right, parents, do you feel helpless when your baby just won't stop crying? Are you feeding, burping, and changing, and all of that's just not doing the trick? Well, in today's Mommy Daddy Handbook, Carrie Isaacson, she's a psychotherapist, and she's the founder of Baby Maven. She's here to explain the signs of a colicky baby and how colic can be treated. Carrie, good morning. I think there are probably a lot of parents that are home that are just stopping right now and saying, okay, because if you had a colicky baby, you know that this is something that can turn your world upside down. For anybody that may not be familiar with this, what does colicky mean?
So colic is defined by the rule of threes, which means babies that cry for in excess of 3 hours a day, more than 3 days a week, for more than 3 weeks at a time.
And do we know what causes this?
We don't. It's so frustrating for parents because we have ideas as parents and as professionals what might be the cause of colic, but there's nothing definitive. We don't know.
My little brother, the third one, because we're 3, was a colicky baby. And sometimes when my mom talks about it, I see the pain in her eyes of what they went through. For those that might be at home watching, that crying baby that just won't stop has so many effects and ramifications afterwards. So what can it do to parents?
Great question. And I think in the past we didn't realize what an effect it had, not just on the baby and perhaps the mother, but on the whole family. Crying of colicky babies is actually a much higher decibel level than a cry of a non-colicky baby, and they use it in torture in some countries. It's that
They use the sound of a colicky baby for torture?
Yes. It is that challenging of a noise to listen to. So it's really dysregulating for a whole family system. And I don't know if it's something you remembered as a sibling, but it impacts not just the baby who's suffering, but also the parents, who can tend to feel helpless, they can tend to feel isolated, they can tend to feel like their very first job, which is to be able to soothe and nurture their baby, they're failing at. So there can be higher incidences of postpartum depression in both parents when they have colicky babies, and it's something that can have a long-lasting effect on the relationship and on the attachment and bonding between the parent and the child.
Well, then what do? Let's say you do have a colicky baby, and then you have this baby that won't stop crying. Yeah. What do?
There are some methods that can help. The number one thing that I think is important for parents is, it's like they say on the airplane, put your own oxygen mask on first. Self-care is the most important for parents. So making sure that you're not isolated, making sure that you have adequate social support, and then in terms of actually when the baby is crying, things that mimic the womb. Some people refer to the first trimester the fourth trimester after the baby's born, trying to make it as similar as possible to what it was like in the womb. That motion is not the back and forth of a rocking chair, but in fact the up and down, like when you were walking when you were pregnant.
Okay.
So exercise balls, bouncing with the baby upright on the exercise ball can be proved to be really helpful. And then looking at things like diet if a mother's breastfeeding, trying to reduce things that might be exacerbating allergies or food sensitivities can be helpful.
There was a study, too, Carrie, that came out last week, and we were talking about this news, and I had emailed you about it, that there was study just out, colicky babies, they're showing now will have more headaches when they're older.
Yes, this is a really interesting study, and I just want to caution that because it's brand new and because it was a small sample size, we can't extrapolate exactly what this means, but it is interesting that on average, they studied around 200 babies, and they found that on average they had 72% greater incidence of developing migraine headaches when they had colic, as opposed to the 26% that didn't. So it is really statistically significant in this small sample. We don't know what that means exactly, and there's also another study that looked at mothers who have migraines are more likely to have colicky babies.
Well, and you got a baby that's crying like that. There's obviously so much to learn, but there are resources that are out there to help parents. So if you want more information, by the way, and more information on Carrie, to learn more about all the colicky babies, you can go to our website, foxhighsandiego.com, click the Scene On tab, and it'll get you hooked up and then get you the right resources. Carrie, thank you for being here.
My pleasure.
Really good information, Chrissy. I have my first baby, not colicky. This one, you don't know.
Fingers crossed.
Fingers crossed.
Yeah, really.
But my goodness.
Can you
imagine 3 hours a day? Wait, 3 hours a day,
3 days
a week for 3 months. 3 weeks?
3 weeks.
Oh, 3 weeks. My mom said it was 3 months.
Wow.
it can last.
It's a lot.
It could last 2 months.
Just with the basic, just basically, it's just hard enough,